An upcoming event with Baptist Health is bringing everyone together for cancer. Everyone's been touched by cancer, but there's more to it than just being treated for physical ailments. Joining me now with more is social worker Sarah Everett and psychiatric nurse practitioner Kathy Holloway, both with Baptist Health Oncology. Thank you both so much for talking with me.
Thank you,
Thank you.
Joanne.
Thank you.
Absolutely. Absolutely. Now, first of all, Sarah, can you talk a bit about what social work is and what you do?
Yes, thank you. An oncology social worker is a vital member of the oncology team. We're assessing needs and we're assessing their psychosocial needs. And what I mean by that is oncology social workers want to look at the practical concerns that patients are facing, such as transportation assistance, financial assistance, insurance help, or information about how to apply for disability. We also are looking at patients' home care needs. Sometimes patients may need equipment at home, or they may need a physical therapist or a nurse to come out to their house. And we're also looking at the emotional impact that cancer has on patients and their families. It's an adjustment, and it can cause anxiety and depression. And an oncology social worker is also kind of known as the heart of the team. And we want to help patients where they are and help them and their families navigate the up and down roller coaster that is cancer.
That is so wonderful. And my father actually had cancer, and I know that that support is crucial. It really is. That is amazing work that you do. And Kathy, can you talk a bit about your role with Baptist Health Oncology?
Thank you so much. Yes. So I am a psychiatric nurse practitioner, and my background is in oncology. And as Sarah mentioned, it's very important to acknowledge the other aspects of a cancer diagnosis. Depression and anxiety are higher in patients with a cancer diagnosis. Often, whether it's the disease or the treatment, we can meet symptoms such as sleeplessness, or appetite disruption. Fatigue, I feel, is so paramount and can be so disruptive to a patient's quality of life. And so I truly value Baptist Health Foundation and their dedication to both the medication and the psychotherapeutic management of these quality of life issues. So I team very closely with Dr. Mary Helen Davis, and together we're able to do this in both an individual and a group setting to make sure that we're addressing the mental health needs of patients alongside that true cancer experience, while the medical oncology team, directs care at their actual cancer diagnosis.
That is so great. And you have something called Cancer University. Can you talk a bit about what that's all about?
Absolutely. And again, just a push and a shout out to Baptist Health Foundation. This is a grant funded program by the foundation as well as Delta Dental. It's a multidisciplinary learning forum designed to react to the patients and the community's needs, to the questions that we get, and the information that they are seeking to live better with cancer. Most recently, we actually transitioned to a virtual forum, and we focused on grief, loss, as well as resilience and coping. I think we're all aware that this past year has been very disruptive. The pandemic has impacted cancer patients so uniquely, in that it has said, you have to kind of bunker down and stay home. You have to kind of give up some of these support relationships, or this closeness that has been so important. And so with this most recent Cancer University, we focused on that grief and loss, and specifically giving patients the permission to grieve, as well as some information and some strategies for how to do that better.
That is so important. I want to thank you both so much for talking with me today.
Thank you. It's been a pleasure being here.
And Baptist Health's Together for Cancer virtual event is this Thursday beginning at 9 a.m. To learn more and make a donation, go to supportbaptisthealth.org.